Welcome to the program. We add to our innovation series with this conversation with Ben Carrington, who joins us to discuss his company, where he is the U.S. General Manager, Limbic AI, one of the founding members of this health technology company that focuses on bringing digital solutions to mental health care. Ben is a former cancer biologist turned entrepreneur who has focused on the field of digital health and using artificial intelligence to bring mental health care access to everyone, everywhere. This is a fascinating conversation and a fascinating topic on so many fronts because it brings together all of the big trends and all of the big themes that we've discussed across this podcast for several episodes, and it brings it together into one very specific arena. We've talked about healthcare. We've talked about mental health crisis around the world. We've talked about artificial intelligence, and we've talked about the use of technologies and some of the issues with privacy, some of the issues with usability, some of the issues of regulation. And this allows us to have a conversation, a practical conversation, bringing all of those things together. And one of the things that was most interesting to me about this topic and why I was so privileged to have the conversation with somebody working for this company is because the company itself, I think, is a model for what we're going to see a lot more of in the future. Limbic AI, and I encourage you to go and look up this company, Limbic, Limbic.ai, is a company that brings together neuroscientists, so medical professionals, researchers, machine learning experts, software engineers, and psychology experts. Now imagine bringing multiple medical disciplines together with multiple technology disciplines, and all of this in the goal of building an interactive solution that allows people a front door to the healthcare system that they might not otherwise have access to. It's a fascinating group of people. I think I would love to spend time talking to all of them to get their perspectives about this. But I do think this is a trend of what we're going to see to come. You're not just going to have medical professionals working in their silo and servicing people. You're not just going to have technologists working to build interesting tools. You're going to have to bring a lot of interdisciplinary talent together and have them focus on a common mission. So Ben is a unique person to talk to within this company because he's been there from the beginning. He's had a front row seat to building this team, building these solutions, rolling them out across the United States and the United Kingdom, and has a very interesting insight into building a company, building a solution to provide mental health care access for people, and making sure that it's usable on the clinician's side and that it protects the privacy of the users as well as the privacy of the medical records of everybody who would be involved in this system. So we covered a lot of ground. I think you're going to find this to be a fascinating conversation. And if you've enjoyed this podcast to this point, I think you're really going to like this show because it brings so many of those themes together and I think gives us a glimpse into the future. So without any further delay, I bring to you my conversation with the general manager, the U.S. general manager for Limbic AI, Ben Carrington. Ben, welcome to the program.
Hey, Brian, thank you so much for having me on. Really appreciate it.
So I had the opportunity to give an introduction before we started our recording here today, but nobody can introduce themselves like themselves. So tell us a little bit about your journey and what brought you into your unique category today.
Thanks. Well, my journey actually started in the scientific field. So I'm a cancer biologist by training. I grew up my whole life wanting to do nothing other than be a scientist. That was all I wanted to be. You know, when kids want to be astronauts or baseball players, mine was a scientist. And so spent my time at college studying that field and went on to do some lab-based science in cancer immunotherapy, and quite quickly realized that it wasn't the field for me in the end after all. And I felt that I needed to get closer to patients and have more of a direct, tangible impact on patients, and trying to bring benefit to them as quickly as possible. And so was kind of scouting around and thought, hey, there's something around this digital technology and digital health is kind of taking off here. There could be something there. And so very quickly started transitioning into the world of startups and digital health, because, you know, technology adoption was expanding rapidly across the world. And I saw that as a space where I could start to make real impact for patients. And then I was really drawn to mental health. It's something that is an affliction that I've had to personally deal with and my family's had to deal with. And so marrying the two of digital technology and mental health just seemed like a no-brainer for me. So was very lucky to join Limbic right at the beginning of our journey, and have been here ever since.
So let's talk a little bit about your company that you represent and some of the great work that you're all doing there. For those who, let's just assume most people have not heard of this organization before. Let's start from there, and then we'll talk a little more specifically about what you're working on.
Yeah, absolutely. So at Limbic, we build clinical AI for mental health. So our mission statement, if you like, is we want to make mental health available to everyone, or mental health care available to everyone, everywhere, no matter of who they are, where they're from, what their socioeconomic status is. And we're currently on that journey by using cutting edge AI to amplify clinicians and augment the delivery of mental health care within the care setting. And so, as you can probably tell by the accent, we're started up in the UK a couple of years ago, and within the UK's National Health Service, which is the kind of centralised healthcare system, we've seen rapid adoption over the last couple of years within the talking therapy and outpatient mental health services that they provide across the country. So at this point in time, we've just celebrated supporting over, just hit the 300,000 mark. So we've just supported over 300,000 patients. And as of the turn of the year, we've got 3 major publications out about our work in helping to improve access to mental health care, and the downstream benefits that can provide in terms of recovery and outcomes.
So talk to us a little bit about the solution. Is this something that a patient directly interacts with? Does a clinician have a role with it? Give us a sense of how it works.
A bit of both. So our solution is an intake and assessment support tool. So this is a chatbot that can live on websites, on phones, and help individuals put their hand up and refer themselves into mental health services. So on that end, we are providing a very neutral and validating experience and supportive experience for patients to um, gather all the information required for them to kind of put their hand up and make a referral into their mental health service. And then on the back end, we are providing that information to the clinicians, so in the form of clinical decision support, so we can help them make way more informative triaging decisions to get that patient to the right step of care.
So, if you're a clinician in the NHS, I'm assuming that this is a little more of a centralized function, and you can get patients sent off to the right specialist relatively quickly. Now, I'm based in the United States. We have a very fragmented healthcare system. I'm interested how this is applied outside of the NHS system in something like the US, where there's health insurance involved and there's many private providers and many hospitals.
Yeah, it's a really good point. There is one assumption to challenge there, and I think it is that actually a lot of the challenges that you've just described there, the fragmentation isn't the same in the UK, but a lot of the challenges with mental health care actually exist across both geographies. So the fundamental root of that is it's a supply and demand problem. There are just not enough therapists to deal with the demand of people trying to access care. And this creates specific pressures that are the same across multiple geographies, like barriers to access. You get bottlenecks in primary care, for example. So lots of people come into primary care with mental health conditions that those services aren't necessarily set up to deal with. And actually in the US, you see a movement currently of trying to bring behavioral health services into the primary care setting, which is a good move. Then the knock-on consequences around availability of services, efficiencies in the treatment pathway, wait times, dropouts, these kinds of things are pretty universal. You are right, though. There are distinctions in terms of the fragmentation of the US market. Obviously, with a private care model, the emphasis is slightly different. So in the NHS, the model is, here is a pot of money, go and support as many people as you can with this pot of money. So it's really about efficiencies. How can we drive efficiencies? How can we help more people with this pot of money? In the US, the emphasis, as we've seen it, as we've moved over here since the beginning of the year, it's slightly different. It seems to be more on the quality of care. Now, this isn't to say that the NHS don't care about the quality of their service, but over in the States here, you see an emphasis on quality of care. You've seen this with the shift towards value-based care, where it's not just purely fee for service. It's idea of providing services for patients that are going to improve their experience and have the greatest impact on the outcome. Those are the ones that are being incentivized to be given to patients. So we see that slightly differently. But actually, our experiences of trying to embed this tool and work with different organizations in the US is within a healthcare system, they're actually very joined up. So your inpatient services, your outpatient services, your specialist community services are all really well joined up. And that works really nicely for a solution like ours, where we're trying to sit and be kind of the digital front door to accessing those services for patients. So whilst there is more fragmentation, and that does present its own challenges, we've actually seen that within a particular system or service provider, that there is real uniformity across that system that makes it quite easy to embed a digital front door.
So when you think about the Limbic solution, um, is this a chatbot that you would place on more of a healthcare provider's website? Is it something that if a company signed up for this service to have special access for their employees, could you do it in that setting? What is sort of the ideal placement of this front door?
So the ideal placement is we're a clinical company, so we want to be working with healthcare services. So whilst we could do something on the employer side, we're way more interested in people who are actively in treatment or seeking treatment and trying to help them get access to that treatment. So, you'd be looking at being placed on websites. We've done a lot of kind of social marketing campaigns to get QR codes out there, SMS links out there. So we've done a lot of work. We've been on the side of buses in the UK. So, people on kind of going through transport networks can click a code and then access a referral chatbot where they can find their local mental health service. And so the beauty of that solution is we can really try and go to meet people where they are. So we can really try and target communities that traditionally are marginalized or perhaps disenfranchised from accessing care.
All right, so I'm curious how adoption has gone. Sounds like you had some good success in the UK. You've started getting some partnerships in the United States. What are you hearing in terms of feedback from the patient side and from the clinician side?
So far, so good. Touch wood, he says. So again, as I touched on earlier, a lot of the challenges are actually very similar. So when I look at the clinician side, and we have a real focus on trying to make the clinician's life as easy as possible, because they are under resourced, they are therefore extremely busy, and there are huge problems with job satisfaction and burnout. And so in our interactions with clinicians, what we're really trying to do is make their life easier by providing that decision support that can make their assessments much more tailored and much more proactive. And so the types of feedback we're getting at the moment are around things like feeling prepared for assessment. So I've got the information, this patient is to me a mystery box. This could be anything, but I've got all this information up front, and I'm able to make a way more informed judgment about where I need to take this conversation. And so that leads to a quality piece. So the assessments are of much higher quality, they're more productive. Our AI system does the heavy lifting in terms of screening in and out, collecting relevant clinical information. And so the clinician can focus their questioning to really be around treatment planning, because that's the highest value task, right? Let's talk to the patient, let's really truly understand them, and let's plan treatment that is going to help them as much as possible. So we're seeing great response on the front end from clinicians, and we're seeing similarly on the other side for patients as well. We recently released a study in Nature Medicine where we looked at improving access and across about 130,000 patients in the UK. And what we saw, we actually analysed around 40,000 pieces of feedback, and what we saw were key themes which are holding up in the US as well. So the feedback we were getting from patients was that they liked the fact that there was an absence of human involvement. So this idea that traditionally when you're trying to access services, you are either walking into an office or you are speaking to someone on the phone. And so with that interaction comes feelings of being judged, there's self-internalization of shame. And so the absence of human involvement and kind of speaking to a robot, which is unashamedly a robot, is a really positive experience. Also, this kind of in keeping with that, this idea that the feedback is neutral, that they're not being judged, and there is a level of validation in speaking with something that isn't human, that helps individuals to self-realize the need for treatment, so make them feel validated. I do need treatment, and I am worthy of getting treatment. So far, it's a long-winded way of saying so far so good.
That's great. Now, I'm I think you've certainly hit on a very important element of healthcare in general, which is the front door.
Mm.
People do not know where to start. And certainly in space as large and complex as mental health care, where you could be talking about one of dozens of potential issues that you'd be dealing with, sometimes complex issues, just knowing where to start is such a difficult task, and especially if you're going through a mental health care crisis. So, given the feedback that you've seen from the clinician side and then from the patient side, how are you thinking about the next generation of developing this? Sounds like it's a pretty functional tool today. People are having good interactions with it, but you have a strong team. How are you thinking about making the next set of improvements? Either what are you hearing from customers that they want to see, or what are you all thinking about as even generative AI as a solution matures?
Yeah, it's a great question. So one of the areas we're really focused on is the really, I guess, embedding ourselves at the core of the whole range of services that are offered by providers. So we've started in the outpatient setting, as I've described. So more commonly here, you see the presentation of depression and specific anxiety disorders. But what we really want to do is, mental health care isn't just about necessarily, the treatment of those conditions within themselves, whether that's inpatient setting or an outpatient setting. But you need to link into potentially educational programs. You need to link into employment programs. There may be some financial programs. There are a variety of different factors within society that can impact someone's mental health. And so one of our focuses is on, well, actually, how do we link up all of these different services in someone's geographic region so that they can put their hand up once, because it's difficult enough to put your hand up and say, I need help. And they can get access to the variety of different services that will combine together to help them recover. When we think about generative AI, what we at Limbic really think the benefit here is to the patient experience and the patient interaction. So the one thing that large language models have proven extremely adept at is naturalized and personalized conversation. And in mental health care, it is so important that people feel that they are reflected in the care that they are receiving. We know this is a barrier, particularly for racial, ethnic, and kind of gender or sexuality. Those kind of marginalized groups typically aren't reflected in the care they're receiving. And so we believe that generative AI can be a really great tool to really personalize an individual's interaction with a healthcare service. And so that's where we're really looking at that kind of really innovative technology and embedding that in our solutions.
What were some of the initial hurdles that you had to overcome, either on the technology side or the adoption side, as you launched this product and got those first customers on board?
I think, the first barrier you will always come up against is aversion to change. That is always going to be the first hurdle. When you are operating in the healthcare space, where the risk is so much higher because of what you're dealing with, right? You're dealing with people's lives, and so you have to be extremely vigilant with that. And secondly, when you're dealing with an AI solution, the questions around, do I trust this AI? How am I going to use this? Is this going to take my job? Is this supporting me? How does that work? So that was really important as we set out to prove that we could operate safely, and we could not only perform at the level required for their service, but boost their services efficiency. And two, that we could demonstrate that the tool was there to really make their lives easier, because any change is hard, even a small change. How many times have you been told, oh, actually, we're going to onboard onto this new system that we're going to use at work? And you're like, yeah, I'll use it for 5 minutes, but I don't really want to. Even if my old way takes me longer, I'm never going to adopt this. And so we had to work really hard at two things. We had to really have boots on the ground and educate staff as to how this product should be used and how it could provide benefit from them. And then we needed to really quickly show and evaluate in scientifically rigorous ways that the tool was safe and was performing effectively. So that was the number one hurdle we had to overcome.
Now, when you think about where the technology is today, I think most people's interaction with AI has been very simplistic things like ChatGPT, or maybe they've had a few applications with Google or Microsoft or something, just very benign stuff.
Mm-hmm.
And adoption has been good, but everything that we hear, everything we read is that it's slowing down a little bit. There was a big curiosity, and now there's sort of an acceptance that this is in the background. So I think the fear of it is starting to fade. It's becoming a little more accepted part of daily life. But now we've seen a lot more conversations, and we've covered some of them on this program about security, what is the AI tool being trained on, privacy, all of the issues that you would assume that any sort of technology like this will eventually come under scrutiny for. So, first question, without getting too technical, is how did you all think about the process of training your AI tool? What data it was going to have accessible to it? Who worked with you on that? And then the other half of that then is how did you all think about the privacy, knowing that you're going to be dealing with people's sensitive health information? The only way they're going to trust it is to ensure that you're taking their privacy seriously. Walk us through that technological and frankly ethical journey that a company like yours has to go on to get to a place of trust.
Yeah, I'm glad you mentioned the E word because you're right, it is an ethical conversation. Um, so we build all of our AI algorithms in house. And so when we set out on this journey, the first thing we set out to do was hire a world class team. So you need the best specialists who operate at the intersection of machine learning and your given discipline, which is mental health care. And so we were able to assemble a team from with world class research backgrounds from the top academic institutes throughout the world. So that's the first thing. The second thing is you need to have a real emphasis on building safe and responsible AI. And when we talk about the data that AI is trained on, the biggest pieces here is that A, your data set is sufficiently large enough, and B, and this is the most important thing, it is representative of the people who are going to use that AI, right? So for us, that was getting a really large and diverse population of individuals. So within our intake and assessment tool, we use artificial intelligence to select additional clinical questions that are going to support the triaging decision. So it was really vital for us that the data set we trained this model on was sufficiently representative of the communities and the individuals that we would be serving. And now in mental health care, that's a big challenge, right? It took a long time to get to that point because you can have anyone from young adults through all the way to people who are in their 60s, 70s from such a diverse range of backgrounds who are trying to access care. So that was the biggest thing, and we were able to succeed in that. Our diagnostic algorithm has over 94% accuracy, which I think is a reflection of really not cutting any corners and going at lengths to find those representative data sets that we could build our products on. The data security piece is a really interesting one. I think this is a big area that the industry really, frankly, we need to improve on. So, you've already mentioned it, but using AI in a healthcare setting is, there's a huge responsibility with that. My personal opinion is if the sensitivity of mental health in and of itself and the type of data you're collecting is a responsibility that shouldn't be taken lightly. So there are a couple of things that we really prioritized extremely early on, like pre-customer in the UK. And so that one of those was security by design. So this idea that when we are building the product and we are building features in the future, when we're iterating on those features from ideation through scoping and design, through development, through release, the security of that data is embedded in how we're building those features. And that leads to some trade-offs with performance and potentially with usability and what that might look like. It's usually actually technical on the technical and the infrastructure side of things. But that was really, really critical for us. The second thing that we really tried to embed was more of a cultural piece. And this was around, instilling principles like the idea of least privilege. So if we are going to have access or some access to sensitive patient information, the fewest number of people within this company should have access to that information. And we should really embed protocols and procedures to ensure that that data is deleted and wiped when we don't need it. And again, it's a cultural piece, but it leads you to set up frameworks that are kind of embedded in your company. Then as you scale, you build on top of those. So we made that decision very early on, and we set out to really invest significant time and resource in obtaining a variety and a myriad of different data security standards to make sure that we could gain the trust of services and patients that we are handling their data responsibly. Now, as we move towards future age of AI and some of these large language models, I mean, when we look at it and we're looking at potential providers that we might be working with, that's the first thing we're asking them. It's not about performance. It's not about, is it easy to integrate with? Is it going to make our product better? It is, we hold ourselves to a certain bar. You also need to hold yourself to that bar. And there's more that can be done here, I think, throughout the community. But I think we're I think the realization, you've seen a lot of cyber attacks over the last, 12, 18 months. They're really on the rise. So I think the community is standing up and taking notice. I think I was actually reading even a couple of weeks ago, the FTC have expanded a health breach notification, or similar to HIPAA, but for non HIPAA qualifying products, which I think is a real step in the right direction, particularly as you look at this space where you have clinical tools and you have more of this wellness space. So really, as this technology, particularly AI advances, particularly generative AI, we as a community need to instill a global culture around security first principles.
Now, you mentioned at the top, one of the most important elements of this was putting the team together. And so you don't have to go through everybody who works for the company, but I'd love to know, you've been part of this have you been part of it from the beginning?
Employee number 5, yeah.
Employee number 5. So talk to us a little bit about who works for the company and the kind of people that you were looking for to put this team together, because this is interesting. You had to find medical professionals, you had to find
Mm-hmm.
software professionals, you had to find those with a specialty in AI, and I'm sure this wasn't easy. So, to the best of your ability, maybe walk us through the process of finding the talent and then putting the team together.
Yeah, it's a really good point. So, and you've hit on some of the areas. Now, obviously, being a software company, we had to invest in getting a product team, right? And I mean, every software company does. And ensuring that we had a quality team that could build real high grade software. But where we spent a lot of our time was obviously on the machine learning team. So we were looking for individuals with specific experience in computational neuroscience. So individuals who were adept at obviously the machine learning side of things, but also had background in psychiatry and neuroscience. And so there are several institutions throughout the world, places like Princeton, Oxford, the Max Planck, and we were looking at individuals from those organizations to come over and work with us. And we were really scouring our network, scouring the literature to understand who were the most preeminent individuals within this space. The other two places that we really looked was one on the clinical side of things, right? For a clinical tool, we should probably have some clinical staff on hand. And to do that, we looked within healthcare systems. We looked at people who know those systems the best, who have worked in mental health care systems. They understand the risks, they understand the opportunity, they understand operationally how those services are delivered. And so they know where products will work and where they won't work. And so we work with a lot of we were working with a lot of service customers, particularly in the NHS. And so we used that as a networking opportunity to identify clinicians who had the skill set that we could bring over to Limbic. And then the third piece is, I alluded to this earlier, but we really wanted to demonstrate through scientifically rigorous means that our solution worked. We saw that as a big gap in the market, that a lot of people talk about, claim certain things about their products without actually backing that up through evidence. And so we worked really hard to build a team of clinical researchers who were experienced in running trials within a clinical context, so not just kind of an academic context. We went out and again sought kind of main clinical research departments, and particularly those, again, who are operating in departments of psychiatry, who had experience with working with patients with mental health conditions, um, and ensuring that we could build a team who could really go out and on the ground and prove that our products were having the impact that we hoped they would have.
I'm interested how that team dynamic goes. I mean,
Mm,
there's a clinician with a certain background that's very medically focused. There's technology teams, and then even within technology, certainly AI, machine learning is newer. Maybe not everybody's keeping up with it. Um, has everyone been able to like speak the same language? And I'm almost fascinated, like how a board meeting goes or how an executive
yeah.
leadership meeting goes when everyone comes from such unique backgrounds.
Honestly, Brian, that's a question myself and our co-founder spent so many hours discussing. Really, what it came down to is creating. When you work in a startup environment, um, everyone's busy all of the time, right? It's hectic. You're trying to achieve a lot, and so we made the conscious decision to really try and upskill people in the various different disciplines that we're working with. Now, you don't need to become. I, as a clinician, do not need to become an expert in machine learning, but I should understand the principles of machine learning, as we've just discussed. What makes a good algorithm? How do we deploy these algorithms? What are some of the risks with building and deploying an algorithm, right? So we spent the time our mantra was kind of little and often. If we're all really busy, we should make sure we have deliberate opportunities for cross-functional knowledge sharing and upskilling of individuals. So we run a variety of sessions across the business that, particularly for new individuals who come into a specific domain, so they can really upskill and understand the technical side of things, the software side of things, the research side of things, the clinical side of things, the safety and compliance side of things. And then accompanying that, we just have some fundamental processes within the business. So the main one is, as you'd expect, is the way we design and develop software. We have this like central spinal processes that's core to our business, where everyone needs to feed in. So you need designers to feed into there. You need user researchers, developers, compliance team, AI, and we've designed that in a way where there are specific stage gates to bringing every individual into that process. And that's been a way we kind of unify all these different disciplines into the sole focus of creating a product.
All right, now let's talk about on the clinical side. So,
Mm,
so for the mental health professionals who are receiving the intake and getting that initial set of assessments, as we're calling them. Now, I'm assuming, I'm making an assumption here that the technology today is really an assessment tool, and the clinician will have to then go and have the conversation and take it from there. Do you feel this is technology that at some point can do the assessment to the degree that it can serve the function of a first meeting with, a clinician, and start maybe to the clinician making recommendations that we think, the AI tool, we think we have identified this, and this. We would normally go this course of treatment. Mr. Mrs. Clinician, what is your opinion? Do you think it can get to that level of triage, or do you think that the nature of the sensitivity of this healthcare is such that a professional will always need to look at the assessment, then do their own, and then on their own experience make those recommendations?
yeah, the answer to this is a bit of both. So what we do right now is we provide support in the form of diagnostic information that can be used to triage. I do see a world in which you've just described where maybe the accuracy and the scope of what information can be collected by an AI system and provided to a clinician grows. So potentially what treatment is going to be most effective for that individual, and doing much more hands-on with the treatment supporting. But you hit on it at the end. I think there is such a nuance and diversity and personalization required in the delivery of mental health care that clinicians will always have to be there. Where my mind really goes to is clinical judgment and clinical reasoning. That is the kind of core element of what therapists, what clinicians do, that isn't captured as nicely in a lot of the frameworks for treatment, like cognitive behavioral therapy. It's more of an abstract aspect, and we cannot lose that. I think there is so much benefit that's provided by that. And so when we think about these tools, we think about, yes, how can we expand the variety of information we can collect, but that this is always going to have clinician oversight, right? This is always going to be delivered by a clinician with their clinical judgment, and that is how we create the highest value interactions between a clinician and a patient.
So one of the biggest barriers to access in the United States and in many countries around the world can often be cost. If the solution, like what you're talking about, is not covered by here in the U.S., it's generally a social plan like Medicare or Medicaid or your private insurance that you may get on your own or through an employer. The NHS obviously has a different scheme, and other countries around the world have different models. Um, are you concerned that this will not be covered by traditional, in the US, at least using insurance terms? How this service would be paid for? Is that a potential barrier to people? Talk me through how you and your team are thinking about ensuring people actually have access to this tool as it gets rolled out.
Yeah, great question. Fundamentally, we're not concerned. We have spent a lot of time, and actually, this is in some of the literature that we published, demonstrating a return on investment of the product, quite comprehensive return on investment based on efficiencies and time savings that we can create within the clinical pathway at assessment and downstream. We've seen impact on wait times, dropouts, and recovery. So there's a nice argument there, and we can demonstrate that pretty effectively. I think you do raise a good point, though. There is a challenge here, and when I look at the digital mental health space, holistically speaking, in the US, we have not seen, the adoption or the uptake at scale of these solutions. And my mind really goes to the digital therapeutic space. So these kind of prescription computerized CBT programs, for specific conditions. They've been out there for substance abuse, for sleep and insomnia, for anxiety conditions, where it's a 8 or 12 week course that is prescribed to an individual standalone by their therapist. And we've seen a lot of innovation there and a lot of investment there. Products that have been cleared by the FDA, new pathways that have been created, but they have just not got funded at scale. They've not been able to crack the reimbursement side of things, to the point that we've seen some really innovative and kind of thought leading companies kind of fall by the wayside as a result. And I think there are a couple of challenges here that we need to address. One is on the evidence side of things. So a big problem that we have is we, as a community, and it's out there in the literature, do not show longitudinal user engagement. It's really poor for digital mental health products. Particularly, again, I'm talking about digital therapeutics mainly here, which isn't a space we specifically operate in, but that idea that people will use, say, a mobile app for cognitive behavioral therapy for a long period of time. It just, people don't. There is not the level. These products aren't at a level of personalization or whatever it may be, where individuals will use this over time. Similarly, you see a challenge around uptake amongst clinicians, right? So there is a myriad of different products out there, and the education of clinicians around when and how to use these products, and in conjunction with what types of treatment, both talking therapies and medication, these kind of things, it can be really difficult. And so I think that's on us as a community of digital product manufacturers to demonstrate to payers that these are not only products that are safe and effective, you've got to tick those boxes, but that are being used and want to be used by patients at scale. Because just because it's available doesn't necessarily dictate that that patients want to use them or going to use them. So I think that's the real challenge here, is proving that. Now, that there's some work to be done on how, I've got some ideas around how we could do that. But yeah, when I look at this space, I can see an ROI for our products quite easily. And really, it's on us to demonstrate usage retention, and that both patients and clinicians are deploying and using this technology effectively.
Yeah, isn't that one of the real challenges, is that it sounds like one of the benefits of your tool is it's a preventative, that if you can identify something that you're going through early on, we get it triaged, you get to the right person, you get treated, it avoids a whole series of terrible events that otherwise would have led to huge healthcare costs. But the very nature of preventative is that it was a one-time use or maybe a two-time use. You were taken care of and you did not need to come back to it. the very success of the tool is the fact that you may not need to use it again for a period of time, but everything in the billing system is set up for activity. You had to go get a test, you had to go get a treatment, you had to go be a referral, you had to go, and it was this long battery list of things that were done, whether or not it was productive or not. It shows this long-term engagement. And I'm curious how you think about this in terms of mental health medications, right? Because not every condition needs a medication.
Hmm.
Some treatment courses are really more therapy through talk or other things that don't necessarily show up on the long, bill chart. So, are you seeing as a long term challenge that payers want to see engagement with these tools frequently, but they also want to see that it led to some sort of a trackable clinical experience? Because I see it as a potential risk, only that if
Yeah.
this all works well, in some ways you should drop off the radar of the insurance company for a while because you don't need to access the healthcare system as much.
Yeah, you're absolutely right. It's like you've seen this play out in the Alzheimer's space quite a lot, right? This idea of preventative drugs for Alzheimer's, where you maybe take a medication, but how do you prove that you were going to develop maybe some kind of dementia issues and you actually don't? And so there's a big kind of way of how we price it. Yeah, so there are some challenges there. I think one of the things we need to develop as an industry is better endpoints. So we have certain diagnostic criteria that we follow throughout treatment, but there is a big push both in terms of like physiologically, um, but also um, more on the side of kind of subjective measures to try and measure and prove that individuals are improving and gaining benefit. So there is work to be done there. However, I think we don't see this as a massive obstacle, because if you can prove that you are improving outcomes for individuals, so this is in a clinical setting where they have put their hand up for care and they are going through treatment. So this isn't necessarily in more of the wellness space, which is getting more into preventative medicine, or the idea of helping people in a subclinical population. But if you can have a tool that reduces the cost associated with delivering care but improves the outcomes, that is always a win-win, right? And any payer is going to buy into the idea that their costs can be reduced and we can get better recovery and better outcomes for patients. So I think there is some work to be done to really define how we measure the success, and by success I mean the impact that these solutions have from a economic perspective, but also a recovery perspective. But it's an equation that, if we get right, is really a no-brainer.
Do you see potential applications beyond mental health care if this technology is perfected?
For us, no, we're a mental health company. The extent of the mental health crisis is such that we are laser focused on supporting people within this space. We've got no interest in moving to adjacent clinical and medical fields.
And there's no shortage of need, certainly. And
Mm.
I'm curious from your team's perspective as you've been rolling this out, if you have seen more adoption because there has been more need. There certainly is the sense that there are more people coming forward than ever before seeking mental health care treatments. So I would assume that might be increasing some demand for solutions like yours. So as you've entered the U.S. market and you've had conversations here, are you seeing the healthcare systems respond to this increasing demand, or has this demand always been there and they haven't had a good solution for it?
Yeah, it's interesting. There's definitely an increase in demand. I think, really, honestly, this goes back to the pandemic, right? The pandemic came at a time where the conversation around mental health was starting to enter, society's consciousness. But the pandemic, I think, really, lit a fuse under that, and exacerbated this kind of the conversation around the mental health crisis. And I know, even personally I remember having being way more cognizant of the impact of my mental health and strategies that I could use to try and create barriers and things like that. So, that fueled a conversation around the mental health crisis. But if you look at the literature as well, it also fueled prevalence. So, since the pandemic, depression's on the rise, the anxiety disorders are on the rise. You're seeing relative increases in mental health conditions for high schoolers and young adults. You're seeing increased substance use. So you're right, like there is quantitatively an increase in demand for these solutions. There are a couple of things that the pandemic did, if you try and frame that point in time as some silver linings, which is services started going online to deliver care. More and more of them. They were a lot more traditionally, bricks and mortar, and that starts to socialize the digitization of these care pathways and operationally how they're delivered, and services become more comfortable and clinicians become more comfortable with the idea of delivering care remotely. And that opens the doors to, hey, we can see the benefit that digital solutions can provide to our service. And that kind of demand we've seen, really, when I talk to some of the hurdles that we faced early on in the NHS, we don't see those as much because people are more comfortable with the idea of AI. They're more comfortable with the idea of embedding a digital tool within their service because, they've basically been doing it for the last 4 years since the pandemic in some way or another. When you couple that with responses that you see at kind of a federal and state level, so more funding is being poured into this space. I think earlier this year, the Biden administration SAMHSA announced, grant funding of kind of 40 million odd for behavioral health opportunities. You see the creation of specific programs, whether that's outpatient or inpatient, or the 988 crisis hotline that was put together. You start to see services are really emphasizing access. They're really embracing digital tools as a way of trying to address the increased demand. So, we're certainly seeing products like ourselves being kind of welcomed with open arms as solutions that can really help them move forward in this digital age of the delivery of healthcare and mental health care specifically.
So now getting completely into the subjective space of where you think something like this could go. You
Mm,
mentioned the chronic shortage of mental health care workers. Even if, and it would be a big accomplishment to get the countries of the world to commit policies and programs to get larger numbers of people into that profession. It would take years to get
yeah,
through all the training and it would take years to get the experience. Do you think it's plausible that for certain mental health conditions that require more of the talk therapy you're talking about, that AI could at some point be developed to the point that in and of itself, it can be part of the treatment plan that takes some of the burden off of providers? Or do you think that the regulatory hurdles to get there are so significant that that is not a plausible path?
I think it is plausible. I think it stops at, will AI take my job as a clinician? I don't think no one should be fooled by, a GPT wrapped therapist there. I think people using those tools, all that really shows is the demand for mental health care. But I do see a world in which AI can be utilized to really do some of, again, the heavy lifting in the actual treatment plan and the delivery of treatment with clinical supervision, with the clinician directing and actually providing care. Yeah, absolutely, I can see that happening. As you mentioned, there are a lot of regulatory hurdles that we've got to overcome to get anywhere near that space. Now, regulation is developing, particularly on the software side and the ML AI space, where they're kind of closed systems. You are starting, and in the US, they're actually one of, alongside Europe, one of, and the UK, one of the kind of forward-thinking nations here. But you're starting to see regulation develop for more adaptive algorithms. So I think it was last year, or maybe even the year before, some guidance came out around predetermined change control plans for algorithms, which is getting a bit technical, but a specific part of regulation that will be really useful for products that may have more of this adaptive learning to them. So the regulatory challenges are massive. Like, there's no way of getting around that. And again, honestly, it comes back to the evidence. Prove that in that hypothetical that we've just discussed, that the combination of the AI and the clinician can deliver care as safely, as well as the historical baseline of clinician delivered care. That's really where the onus is, and that's going to be the proof point.
So last question for you is on as this goes more international beyond Europe and North America into other parts of the world. Many people that I've talked to who are in the medical innovation space talk about some of the cultural barriers that you can experience in different parts of the world where their relationship to healthcare is affected by any number of cultural norms. And then you layer on that we're talking about mental health care, which unfortunately has stigmas in some part of the world as well. As you're all thinking about the future and the future applications of this, how do you think about that from a cultural perspective? That there may be barriers that go beyond cost, that go beyond technology, that there may be individuals out there who are in a society where it's just not talked about openly, or it's not something that's embedded into their healthcare systems. Is there some way to provide these services to those places that still respects the cultural norms, but allows people who have these needs to still get the care that they're seeking?
Yeah, there absolutely is. And actually, that's one of the things, even moving from the UK to the US, that has been one of our main focuses is the localization, right? If you're inherently talking about, if we're talking about talking therapy, which is the space we operate in, you're talking about treatment that's delivered through language. So language is such a fundamental, if I take one aspect of culture, language is such a fundamental element that we have spent a lot of time investing on how we localize the product to the US market in that sense. I think when you look beyond that, look, you're going to have to see some form of healthcare system reform, and that can only be directed at a federal or government level in some of these communities. And the one hope I have is we are such a globalized society now, and to counterbalance many of the downsides of say take social networking and social media for example, one thing it can do is it can spread the idea that the socialization around talking about mental health. You see tons of campaigns that go around the globe, and so I have a lot of faith that we are reaching that point. When you look at a lot of government policy over the last couple of years, there's been a real emphasis on pouring funding into mental health services because it is inextricably linked to a productive workforce. And so you can see that as a tangibly economic output that governments will really want to invest in. And so I have a lot of faith that there we will start to, in communities and countries and areas where perhaps we aren't as far along the journey around the socialization of mental health and the need for mental health care, that they will catch up. I also have firm belief in digital health technology's ability to go and meet that need. We've seen it. We released a Nature paper where we compared services who had our product as a front door versus services that didn't, and we saw about 40% increase in referrals from racially marginalized communities, so Black and Asian communities. We saw about 200% increase in referrals from non-binary individuals and sexual minorities. And so there is proof out there that at scale you can really support these communities once you create the infrastructure that enables them. You have the care infrastructure on the back end that can then support them. And like I said, I've got faith that we're really moving in the right direction there.
You've been very generous with your time. Would love to give you a moment here to promote Limbic. If people would like to find out more about the company or about you for that matter, what is the best way for them to do so?
The best way to find out about us, go hit up our website, www.limbic.ai. We are a very noticeable company. We're a hot pink healthcare company. You typically see companies branded in blues and greens. Not us. We're in for the hot pink. So go and check out there. You'll find all the information around the research that we've done. We're really, really proud of it. It's something that we hold ourselves to incredibly high standards. So you'll see all our publications, you'll see our blogs, our podcasts up there. And feel free to get in touch with us on LinkedIn, Twitter, Instagram. We're really trying to pioneer a conversation here around access to mental health care. And anyone who's interested, please do just reach out.
Great. We will post all of those links in the show notes as well as the episode description of this program. Ben, thank you so much for taking the time to talk us through this great product and solution, and we look forward to hearing from you again.
Awesome. Thanks so much, Brian. Appreciate you listening to me yabber on for an hour. It's been great fun.
All right. Thank you.
Cheers.
Part of the reason why I enjoy doing this program is I always walk away from these episodes feeling hopeful for the future. When we have people like Ben and all of those that are working with him at Limbic, working for a common goal and a common good to address a very serious issue in our world, the access to quality mental health care, and helping people gain access to the help that they need to address those issues before they become crises. It's very optimistic for how technology like artificial intelligence can be used for good. So often we focus on the risks of new technology, and justifiably so. But then when there's folks out there who are trying to use that technology to expand access for healthcare, to make the process easier for people who are in a difficult situation, and you have teams being brought together that in any other environment, in any other time, wouldn't have worked together. It's a very hopeful picture for the future. So I certainly wish Ben and his team luck as they continue to roll this solution out. Hopefully, our conversation today gives folks something to think about in this space, whether you would use this tool or not, whether a medical office would offer it or not. It's important to know that this technology is being worked through and worked on, and that there are many out there who are trying to address the issue of mental health care access around the world, including in the United States, where we spend a lot of our discussion today, and in the United Kingdom as well. If you like this program, if you like the subject matter that we cover, I can only ask you a couple of things. Number one, share with your friends, share with your family, share with your coworkers. The only way we can grow this community of curious minds is to have people like you who listen to this show and enjoy it, share it with others. Even if it's just a few of the clips, go to our YouTube channel, find a clip from this or any other program, share it with your network, and get a few more people to come into our community and listen to these programs. Follow us online. You can find it in my YouTube channel, the Brian J. Matos podcast. Just search that on YouTube. You'll find the program there. You can visit my website, brianjmatos.com. We also have links to our YouTube channel from there. Subscribe to the channel, like our videos, share on your social media sites, and feel free to promote my website, brianjmatos.com, where all of our podcast episodes are available for free. You can also subscribe to the podcast anywhere you get your podcasts. We have the show available on Apple Podcasts, iHeartRadio, Spotify, the Odyssey app, Libsyn, and pretty much any service that you can think of that has podcasting available for you to subscribe to. You can find our shows there. And you can find full episodes again on my website, brianjmatos.com. Thank you as always for listening. I hope you will share this program with your community of curious minds so we can continue to grow and learn together. And until we speak again next on the next episode, I encourage you all to stay curious.